Hey, good evening, everyone. Welcome back to Decoding Life with Aanchal. Our topic for today is the third wave of COVID and its impact on children. And our guest for today is Dr. Nihar Parikh. We're just going to wait for him to join. And in the meantime, let me just send him an invitation. Okay, we're just waiting for. Hi Yasmin, hi Aishu. Hey Isha, how are you? Long time. I, you cannot hear me. Guys, can you hear me? You can't hear me at all because I don't see a problem with the audio. Archana, yes, of course, we're going to take all your questions. Whatever you want to know about. Okay, great. Whatever you want to know about the COVID, we will take all your questions. I'm just waiting for Dr. Nihar to join. Give me a second. Oh, damn. Isha, I hope you're all right. I'm really sorry to hear that. Take care, you guys, and stay safe, stay indoors. I do hear that this Omicron is not so dangerous, so hopefully you'll be fine. Hi, Sony. Let me see, let me add Dr. Nihar. Okay, there he is. We've added you, Dr. Nihar, so we're just waiting for you to join. Hi, how are you?
Good. Can you hear me?
Yes, very well. We can hear
Okay.
you loud and clear.
Okay.
Okay, so I'm just going to introduce you. Dr. Nihar Parikh is a very, very well-loved, liked pediatrician in Bombay. All my friends send me messages saying we go to him and he's amazing and all of that. He's also the director of Cheers Childcare and very happy to have him back on my chat. I've had him in the past. And
Yes, it's a pleasure, Archana.
my pleasure. Thank you so much for accepting. And
No problem.
I know you are super busy, and it's a really, really crazy time right now with the Omicron or the COVID or whichever version of it is now widespread. There
Correct.
is a meme circulating that I saw this morning that says that if you don't have friends who have COVID right now, then you need to have more friends.
Correct.
It's really
When
that.
you're not out there enough, you're not known enough, or you've not been exposed enough, then you're a recluse.
Exactly, exactly. Okay, so just before we dive in, a little bit your audio keeps going off. So if you can
Okay.
just check your audio
Sure.
setting.
Sure.
Um,
Am I more
yes,
clear now?
now, yes, better.
Okay. Okay.
Okay, okay. So tell us, Dr. Nihar, what's really up with this third wave before we get down to its implications on children? But what is really going on with the COVID? I mean, how much longer are we going to have to deal with this?
So basically, Achal, I'm going to take this opportunity. First, I want to thank you for this opportunity. It always helps to kind of spread the word as fast as possible. Platforms like this, they help us to get to more and more people
Right.
and help us to keep them calm, to keep them relaxed, and give the real picture out there because the rumor mill is a very scary one.
Correct.
It kind of, if you changes life sometimes if you're concerned.
Correct.
So let me say by saying that, start by saying that this Omicron virus is just absolutely gone all crazy. It has spread like a forest fire.
Yes.
It's infecting anybody and everybody because it's extremely, extremely contagious.
Yes.
But at
Sorry,
the
Dr.
same,
Nihar, we're having too many people messaging that your sound voice is echoing. So,
okay, let me try and do this.
yeah. Yes, guys, we're working on it. Just bear with us for a second. We will have him back in a second. Yes, we're working on it. In the meantime, if you have questions, hold on to it and we will take all your questions in the last 5 or 10 minutes. Hopefully, we'll be able to attend to everything. Sorry, what was that? Okay, he's left us. Let me try and add him again. Just waiting for Dr. Nihar to join back. I hope you guys are all staying indoors and staying safe. Even if you don't have COVID, guys, please stay indoors because it's really spreading.
Am I more audible? Better now?
Hi, you'll have to speak a little more for me to know because you keep echoing and you keep going off. So,
Okay. Now you think it's better?
yes, much better. Much better.
Much better?
Yes, much better.
Okay. All
Haji.
right. So let me start by saying this Omicron has turned into an extreme forest fire in our city.
Right.
We have every child, every parent that we know is either exposed to it or currently going through the disease.
Yes.
Like I put it on a video saying that this is the last ditch of the COVID to try and create havoc.
Okay.
It is basically its last effort to survive. I'm not saying it's going to go away after this,
Okay.
but it's definitely going to lose its threat. It's going to lose its grip of fear over us.
Okay.
Because for the first time after going through these Omicrons, we are going to realize that there is nothing to worry.
Okay.
It's a 2 to 3 day virus. It's going to come in and go into our systems, cause a little sore throat, headache, fever. And I'm talking purely from the pediatric point of view.
Okay.
I'm not getting into adults. I'm not getting into what they will be doing and what not. But what we are realizing in pediatrics that this is a very flu-like virus, for a lack of a better word. Children are recovering. We had few patients today who are 3-month-old and 6 months old who have turned positive for the virus. But they are absolutely hale and hearty. In the next 3 days, in the next 4 days, in the next 10 to 15 days, I think 70 to 80% of the kids in our town are going to go through this. They're going to develop natural immunity, which is the best form of immunity any virus, any disease can have.
Okay.
And then is the phase if and when the vaccine comes, that will be the last nail in the coffin of the COVID virus.
Okay.
So things are falling into place well. We were initially worried when the Omicron came about because we didn't know how much havoc it would play.
Correct.
Would it be as bad as the Delta, which was the most terrible times of our lives? Even when with kids, we had admissions, we had the dreaded MISC. But this time, since the primary disease is so mild, I don't expect or suspect future short-term or long-term complications in kids who are going through this disease right now.
Okay, it's very heartening to hear this, Dr. Nihar, because I was also chatting with a dear family friend of ours who's also a doctor, and he said this is pretty much the beginning of the end, and that the pandemic is on its way out. So I'm assuming that this is a sentiment that is being echoed by most doctors, and we're very happy to know this. But I know you're saying everyone's recovering in a couple of days and the symptoms are mild. The fear for COVID is clearly not, what you're going through presently when you have the COVID, but its long-term implications is what seems to be really scaring people. Therefore, is there anything to worry about Omicron for people who are having it presently? There's also a mom on the chat right now. Their entire family, including a 2-year-old baby, is presently tested positive. And they're on the chat. So I really want, for the benefits of all our viewers, to know that what is the long-term implication of having
See, in our experience, when the primary disease is a dreaded one, when the primary disease is a fever lasting for 7 to 10 days, when the primary disease is causing chest involvement and damage to the blood vessels in the arteries, that's the time is the long-term consequences of long-term heart problems, long-term lung problems, long COVID syndromes. These are the things that we are worried if the primary disease is a severe one.
Okay.
If the primary disease is a flu-like, have we ever thought that the flu virus is going to cause long-term implications? No, never.
No, right.
Because it's a very mild disease to start with.
Right.
So that's what this is turning into.
Right.
You should also remember that the viremia in the Omicron, meaning the virus spread in the bloodstream, is much lesser than what the initial Delta was.
Okay.
Which means damage to different parts of the body is much lesser. Okay. Damage, spread of the virus to different parts of the brain, heart, kidney is much lesser.
Right.
The blood vessel damage is much lesser.
Right.
So it's turning out to be a ear, nose, throat, head kind of a sinusitis, pharyngitis, rhinitis, and otitis, ear infection kind of in this area, sort of a syndrome.
Okay.
which is what the typical flu is.
Correct.
So since we never feared complications long term or short term of the flu, I would not worry too much about the
Okay.
Omicron causing short term and long term as well.
Long term. Okay, that's very heartening to know. The other thing that I wanted to ask is that, this is becoming pretty much like a flu, you said. Is there a chance that, it's a very bizarre question, but is there a possibility that there is a lot of false positive being tested? Because, a lot of people are feeling that literally they have nothing more than half a day's fever or at the most a little sore throat. Is it possible that the RT-PCR can show a false positive?
So there is nothing like a false positive.
Okay.
I would say there is a lot of false negatives out there, but there is nothing like a false positive. Now, whenever you have a mild symptom,
Haji.
and you or your child, or no symptom, and you and your child is positive, in a very optimistic manner, I would say it's a time to celebrate. Take it as a vaccine shot.
Okay.
Take it as a situation where you are harboring the virus.
Right.
Your body is fighting the virus without causing any damage to your body.
Okay.
And you will end up developing good amount of antibodies, and so will your child.
Okay. Wow.
Now, I want to put it out there as a very optimistic picture, not to create a false facade of optimism, but I'm very keen that people try and lose their fears of the disease.
Right.
It stops giving people sleepless nights. I want to try and put it out there that, look, it is a blessing in disguise that the Omicron has come.
Right.
There are researches that show that Omicron is soon on its way to become the dominant variant, which is better for us long term and short term wise.
Right. Right. Okay. This is, and just for a like a quick humor thing in between, but if you respell Omicron, it spells moronic, right? I don't know if you've seen that.
Yeah.
You put all the words together differently and it spells moronic, Omicron.
I know. Yes, it does. I never thought of that. I think that's amazing. Yes.
It does.
Yeah, but you know what? Before we try and badger the virus, I think we'll show it due respect for a week or two more.
Sure.
If the trend continues the way it's going, then I think we'll just kill it. Absolutely.
Okay.
Now there is, we are not God. We don't know what the future is.
Correct.
We only are good analysts. We study trends. With the kind of number of kids we see, we predict trends.
Right.
And that's what we are banking all our assumptions on.
Right. Right.
So this is a purely what we call as evidence-based medicine practice. So unless until really, we are unlucky, I think we are seeing the beginning of the end.
Touch wood. And also, please tell me that, during the Delta variant and especially during the first wave as well, most doctors recommended a lung CT irrespective of whether you felt any post-COVID problems, issues, breathing issues. Is it also necessary to get a lung CT post-Omicron?
So in the Delta itself, when the pediatric population were getting infected in the second wave, even at that time, there was a very small percentage that got lung involved. I'm not saying they did, but a very small percentage.
Okay.
CT scan, as used in adults, almost became a screening tool. That even if you're negative, just get a CT scan done and if it shows fluffy cannula, it's positive.
Correct.
Was never a tool used in pediatrics.
Right.
So when the disease was as bad as the second wave, CT scan and lung involvement didn't have that significant role to play.
Right.
I would not worry about the Omicron at all when it comes to lung.
Okay, now coming down to children, coming down to the number of cases you are seeing, how, what is your take on all of this? And especially for parents, for their peace of mind, what is the message that you want to tell parents? If they
I'm going to retrospectively put it that if your child has not turned positive so far, I would call it unlucky.
Oh.
I'm not saying go out there and get turned positive. But everybody, there is no way you are going to protect your child against this infection because it is extremely contagious.
Okay.
It is so contagious that even if a person walks past by you and you don't have your mask on or guard on for a second, you can catch the virus.
Okay. Wow.
So eventually what's going to happen is, I think a huge population of our city in the next 15 days is going to catch the virus.
Okay.
We're going to have a huge turnover of antibodies formation in all our children.
Okay.
I would not want the parent to panic even if the child develops fever, sore throat. Keep your guard on. When I say you're eventually going to get infected, doesn't mean you run around with your mask down.
Right, of course.
You still take the standard precautions.
Right.
You still follow everything you're doing so far. But even if unfortunately you turn positive, I would turn that into, make hay when the sun shines.
Correct.
And get your antibodies started to quickly. And the protection of your child will start.
Okay.
So we want that. And
Okay.
the kind of speed at which this virus is infecting kids, I see this wave peaking in the next 15, 20 days.
Okay. And when do you see it ebbing away?
I mean, every wave on an average lasted 2 to 3 months. This I would predict it will last half the amount of time, a month and a half.
Okay. And so to extrapolate that prediction, when do you think we will more or less be out of COVID? Do you see that happening this year?
We will never be out of COVID.
Okay, maybe
But-
not with the fear or the danger of it. Maybe not okay from
No, not even philosophically. I'm talking about mentally. I
Right.
mean, medically.
Right.
This virus is going to be around.
Right.
You're going to see Omicron's brothers and sisters and cousins always be around like the flu virus.
Okay.
So every year you will end up taking shots for a while, maybe 5-7 years down the road. But Omicron should stop becoming a deadly disease within the next maximum 6 months.
Okay. Okay.
A feared disease.
Okay. Okay. I'm going to actually take this question. I just saw it pop up on my screen that post-infection, when should we vaccinate? I think this is a very, for people who are still to take their first, second, third vaccine.
There should be nobody on this chat who's not taken their shot. I think I would strongly hope and keep my fingers crossed that whoever's listening in, I think has taken 1 or 2 of their shots.
Okay.
But the time period between the immunization and the previous infection usually depends upon the severity of the infection.
Okay.
When the Delta wave was at its peak, people were getting infected severely. We were recommending 3 to 4 months of gap at least after full recovery.
Okay.
With this kind of a mild sickness, I think a month could be good enough.
Month should be good. Okay. Okay, now really coming down to the main part of the chat, vaccine for children. What is your opinion on all of this? And the government is now opening up, I think, 15 to 18. I'm not sure the age bracket.
Correct. Started 15 to 18 today.
15 to 18.
See, I always, 2 things I always spoke about the immunization when it comes to children. That this was never a deadly disease in our country.
Okay.
It was never killed. I mean, we were never losing children to the virus.
Right.
So now we are actually going to vaccinate our children against disease which were never that severe.
Right.
But with the presumption and assumption that maybe
could
if
get.
there's another strain
Right.
that can turn harmful again,
Right.
you want to get them vaccinated. So I would strongly encourage all parents to vaccinate their children, but follow the government norms, follow the age recommendation set by the government. If it's 15 to 18, take it. If your number is there, take it. If it's Covaxin, take it.
If it's Covishield.
Don't take it. Take what is recommended because there's been enough research done in our country.
Okay.
We have the gift of numbers in our country.
Right.
So going wrong over the research is very, very uncommon and rare.
Right.
So I think we should trust ourselves.
Right. Shilaza. Okay, I'm not getting this name right. I'm scared of vaccination. Please tell me this is for children and not for yourself, because like Dr. Nihar said, I hope every educated adult by now has at least taken 1 dose, if not more. Which also actually brings me back to, this whole thing in the Western world of free choice, and it's my choice and it's my body and my life and all of that. What is your opinion on all of this? Why are people so resistant to vaccine?
I mean, people fail to realize when you don't vaccinate yourself, you're not only endangering your life, but you're endangering people around you.
Yeah.
Your capacity to infect and get the disease is 5 times more if you're not vaccinated.
Right.
So, Aanchal, I'm going to leave it at that. I mean, if you're a masochistic is fine, but if you're going to turn into a sadist, there is nothing that I can say that is going to convince you.
Right.
So if your scare is not bad enough, the scare of harming others should be bad enough to make you get out of your house and take that shot.
Right. Okay, this lung infection question we've already taken. Archana, I'm going to drop that and I'm actually going to go back and see what else, because we had tons of questions. Lung infection, long-term research, doctors answered that as well. Many people getting vaccinated. Okay, there's the whole discussion of Covaxin and Covishield, but I don't know if you want to get into that.
No, I don't. I think parents should not get into that.
Right.
It is not. It is not an option. Covishield has not come up with pediatric vaccine.
Right.
Covaxin is well researched. You don't have a choice. You don't give.
Right. Okay, I think we've kind of. However, with kids who've been born prematurely and now toddlers, what's your advice? I don't know what the meaning of this question is.
Yeah, so I'll answer that question. It's a significant question. There is a misunderstanding. People feel that if their child were born premature, they're going to remain immunocompromised throughout their life. It is incorrect.
Okay.
Once a premature child born reaches around 1.5 to 2 years, the entire immunity system is like a normal comparable child born at a full birth weight.
Right.
So if your child is about 2 years, is doing well, please don't think about that child as a premature child. It's not going to be a special situation in which they're going to get preference.
Right.
So please wait for it. And you can wait for it very, very absolutely without any fear, because your child is now at par with any normal child.
Right. Okay. Kanika is repeatedly asking about RT-PCR showing positive. Kanika, we've asked and answered. I already asked Dr. Nihar this question. How do we know if a person is down with COVID or if it's just viral? RT-PCR, I'm guessing, is the only way.
It's impossible to differentiate between a normal flu and a COVID. I mean, if there is fever, as of now in the last 15 days, if your child has a fever, sore throat, body ache, I'm pretty confident in saying that 90% of the time it's going to be COVID.
Okay.
But the behavior and the severity of the disease is just like the flu, so you need not panic.
Okay, so now what is your opinion with the schools restarting and children getting back and going out into parks and public places and going back to schools and classes? We need to go back home again?
I suggest every parent to continue what they're doing.
Okay.
Don't worry about the virus. If and when, as a united body of doctors and government assess that this disease is actually causing trouble in children and putting them in hospitals,
right,
we will shut schools and activities overnight.
Okay. Got it.
Now, if there is a fear of drastic increase in numbers,
right,
then too we will postpone the opening of schools.
Okay.
Just as a preemptive, just as a extra proactive step.
Okay.
But don't take that call on your own. Just follow the guidelines. Just continue doing what you're doing. You will hear and know about it as soon as things change.
So your underlying message is please follow the government guidelines and please trust our government to do what they're doing and they know what they're doing and saying.
I want to take this opportunity to make people aware that our government and our country has done a fab job so far.
I totally agree with you.
And everything, because managing a population of our kind and curbing the disease like they have, I think hats off. Absolutely amazing.
Really. It's very nice to hear that corroborated from a doctor, because I just feel like people have such weird opinions about. Okay, I'm going to take this next question. What are the effects of COVID if one of the kidneys in a child is only 14% functional and the other one is fully functional? Is there anything to worry?
A fully functional kidney, one is good enough to make that child a normal level. It doesn't put your child in a category to take as a special needs child, and I think the vaccine will be given as and when his age group is recommended to.
Okay. Vaccine has not been tested, time tested. So will there be a problem with growth, puberty later on as adults?
I'll tell you, with Covaxin, the mechanism in use is not as aggressive as the Pfizer mRNA as a genetic mRNA vaccine.
Okay.
So I would suggest this is the structure which in a vehicle used for a lot of vaccines in the past. None of those have caused any significant abnormalities in our children.
Okay.
So I would request parents to trust the process. I would request the parents to trust this mechanism of vaccine and go ahead without thinking of any long-term consequences.
Okay. There was also a question on alternate medication, homeopathy. I don't know.
I have full faith in homeopathy. I believe they have a role to play as and when. But in
Okay.
this case, less likely, nothing can replace a vaccine.
Okay. Blood thinners, are they necessary post-COVID?
Absolutely not in children. Like I said, it's not harming the blood vessels in children. Never had. Few
Okay.
kids initially had the second wave, but not so far in this wave, so I don't think it's required.
Okay. If the child has had COVID, should we wait before we vaccinate them? Their child is 15 years old.
If it's a mild disease, a month is a good enough gap.
Okay.
If the child is to a major disease requiring hospital admission, then 3 months gap.
Okay. Yes, Alicia, we will be saving this live. It will be on our page, and hopefully Dr. Nihar will be able to share it on his page as well. The live never goes away. It's there for you to refer even after 6 months. So don't worry. I have tested positive on home test, and my 8-year-old has symptoms but is negative on home test. We are assuming COVID and following protocols. I don't think the home tests are very accurate though, are they?
So the home tests are 65 to 70% accurate. Even the RT-PCRs, some cousins of Omicron, that is the BA2, I think, is also known to escape the RT-PCR. So I would request every parent to remember that if you are having symptoms and you are positive and your child is having symptoms, take it as COVID,
Okay.
keep them together. I would not worry too much about the test turning positive.
Okay. What's your take on the news on Covaxin getting the expiry date extended? There is a message going around. I don't understand this whole skepticism with this, hate the pharma world and everything. You cannot take away the fact that we are in a pandemic. Unfortunately,
Correct.
people have died, people are dying. So even if the pharma world is making money, there is no option and there's no way out of this. I don't understand this logic.
I think, we should thank people around us that they're still giving vaccines for free. Now, whether it's coming from the taxpayer money, I think that's the least thing we should model.
Yeah, I mean, at the end of the day, we can't take away the reality that we are in a pandemic and people have died. I mean,
Absolutely.
so it is the pharma world that is going to come to our rescue, and this nobody else can do anything about it. Okay,
Yes,
I'm
we will have to do
going to.
it.
There was one question I think I missed. Can the child infect others in the house after the 4th or the 5th day of COVID?
Yeah, so with the Omicron, the infectivity number of days have been brought down to 7. So I would say if your child has been without fever for the last 48 to 72 hours, the chance of yours infecting someone else in the house is very low.
Very low.
Still, I would like to request parents to follow the 7-day quarantine
Okay.
and isolation protocols post start of symptoms.
Okay, 7 days is mandatory. It's not necessary for the original 10 or 12 days quarantine.
7 days at least. This one they brought it down to 7 days. Some have even said 5 days, but I think that's a bit too aggressive. 7 days is a good enough.
Okay, very interesting question. What about reinfection? Is it likely with Omicron? A lot of people have had COVID twice.
Yeah, we get flus again and again all the time. So that's my answer.
Right. How long do the antibodies remain?
I would say 3 to 6 months post an infection is a good enough time frame to consider. With a full-blown Delta, which was a severe disease, we've narrowed it down to 9 to 12 months. So with a milder disease, I think 3 to 6 months is a good time.
3 to 6 months, okay. My baby is 10 months old and he was showing COVID symptoms, so we did, okay, this was asked and answered. Been worried because this is also asked and answered. Also, a question from me, if you're positive, how long a gap do you need to give before you can plan a pregnancy?
So, if you're to plan a pregnancy, I think once you have passed a month per se, I think you're okay. But I don't see that being anyway a problem that would hinder your plan to get pregnant.
Okay.
I mean, if you go through a disease, you recover, and then you plan again.
Right.
Just to be on the safer side, maybe at least a month after you've been through a significant disease, start.
Okay. I want to ask you a general question that we are talking about 15 to 18. Isn't that too narrow a bracket? Shouldn't we be like speeding up the whole process of trying to vaccinate children already?
I know, but our numbers are huge. Huge.
Right.
So we'll have to give them some time. I think once they roll out the infrastructure to cater to 15 to 18 and see how well it works. I
Right.
think in a month or two they will put in the above 12 as well. I think this is just testing the waters kind of an event where they are
Okay.
testing, the infrastructure, the
Right.
approach to handling these kids coming to these youth centers. Are they going to be with parents? Are they going to be okay alone? If they give the shot,
Right.
are they going to cry a lot? Do they have to spend 20 minutes consoling every child? So
Right.
what happens is how this entire system is going to take is very different than an adult.
Correct.
There's always going to be someone with the child. So, I
Right.
mean, if we have with that into consideration, we're doubling the amount of people visiting the jumbo center.
Right. Because given that, we are the largest producers of vaccine in the world, we are also really slow and far behind on the booster shots for the adults. And now we're only opening 15 to 18. So I'm just asking from that point. I know
Correct.
we're a
No,
huge population, but
they will have to speed up the process, but I think they're testing waters for the next 1 year.
okay, okay. Okay, I'm just taking the questions that I think are relevant because of this flu and COVID symptoms. These are all asked and answered and covered in your conversation at some point. What is the meaning of long COVID?
Long COVID syndrome was a complication seen specifically in children above 8 to 10 years of age. In the
Okay.
very strange second wave, Delta wave, where the disease itself lasted for 7 to 10 days. And
Okay.
after that, for 3 to 6 months, children used to suffer from something called long COVID syndrome with loss of appetite, persistent headaches, mood swings, complications in attention, finding it difficult to focus, very low energy levels and body weight.
Oh my God.
But
Oh,
like I said, it required a severe disease for the long COVID. This is a minor disease, so I don't expect or suspect any long-term consequences.
okay. An adult question actually that if you've had Omicron, how soon can you start exercising? I want to know as well.
Now, if you feel good enough, you can start after 7 years.
Okay, okay. What is the post-COVID care protocol for kids? I think that is also something you have answered. Food. What is the food? Healthy food. That's it.
Viral food, like you take plenty of liquids orally to flush out the virus as much as possible.
Okay. Okay. A lot of people joining. Very few questions. I'm just scrolling. Give me a second. I've heard of docs prescribing antibiotics for cough and cold. Is that even advisable? Matlab?
So what happens is whenever a child is sick more than 2 to 3 days, the
Uh-huh.
Omicron and the virus itself drops the immunity.
Huh.
And in children, we don't want them catching secondary bacterial infection. So many a times, if the cough is bad, we do start a backup antibiotic, but per se, no antibiotics is required to kill the virus.
Okay, so that's only if it's symptomatic, mainly primarily.
Correct.
Okay, my daughter's developed social anxiety. I guess she fears even of thinking of school reopening and starts crying in the middle of the night. She's 4.5 years old.
That's a common problem, but we have to deal with it. I think taking the right counselor help at the right time is extremely important.
Right, I think
So
counseling.
I think talking to a good counselor, dealing with it before school reopens, exposing the child in piecemeal fashion, taking the child for a drive to show the school a few days before,
Right.
taking it step by step, opening all channels of communication to your child, and taking the counselor's help is the right way to go.
Right, right. Okay, so is there anything you feel we've left out that you would like to share while we wait for a couple of more questions?
Yeah, so let me just quickly sum up because I'll have to head out to another call. So again, see, we are here to help you. We have, as doctors, all our lines open to communicate with you. But unfortunately, this virus is spreading very fast as of now. But fortunately, it's just causing a minor disease.
Okay.
So I want every parent to remember that stay calm, stay cool, stay collected. We're going to get through this. There is a huge halogen light at the end of the tunnel now.
Very nice.
So hopefully we just reach there as soon as possible. When it comes to your children, all the doctors in town and the government has everything under control. Just trust the process and take it.
Right. Thank you so much, Dr. Nihar. It was very kind of you to take time out and come on this chat. I think a lot of questions have been answered. To all our viewers who've joined late, this chat will stay on my page. Please feel free to refer to it anytime. For all the questions that I've not taken, the only reason being that somehow it's been answered by Dr. Nihar already, but we've pretty much covered all your queries. Thank you very much. Thank you for the amazing work that you do. We don't say this often enough to all the doctors and the healthcare workers in our fraternity that these 2 years we would not have been able to get by without your support and without the kind of work that you have done. Thank you so much.
Aanchal, I want to thank again you and the platform. And I want to take this opportunity again to thank every parent out there who trusted us.
Right,
See, us doing our job is only possible if parents trust.
right.
And it's not easy for you to trust someone else with your child's health. So again, a lot of gratitude to all the parents out there who've shown blind faith and trust in us. It just makes us get out of bed every day stronger and wiser.
Thank you so much. It works both ways. Thank you so much. And quickly to all our viewers, we're coming back tomorrow with another chat at 6 o'clock, and we are actually going to come with a very dear psychic friend of mine. We're going to take your questions live. So please join 6 p.m. tomorrow. Follow our page, follow Dr. Nihar, and we will see you soon. Thank you so
Thank
much.
you. Thank you, Aanchal. Take care. Have a good day.
You too.